All right, Dr. Jeff, we are live here. Hold on, Harvey just walked into the room. Let me kick him out here. Hold on.
Now it's a show. Now we have we got it going on.
All right, we are live. Welcome, everyone, to another episode of the Expect Miracles podcast. Today's episode of the podcast is brought to you by Settex Grip. You can visit settexgrip.com for the best gripping technology on your eyeglasses, earbuds, phones, and gaming controllers. Our listeners get 25% off when using the promo code Dr. Pekka 25 at checkout. That's Dr. Pekka 25 at checkout. So today's episode is very special to myself and to Dr. Jeff. It's the reason why I got into upper cervical chiropractic. We are talking about post concussion syndrome. I've had several concussions from ice hockey and among other things. Dr. Jeff's had a few from rugby, probably even a little bit. Any soccer concussions, Jeff?
Nothing concussion level, but definitely head knocks.
Yeah, definitely some head knocks. And today we're going to go over the ins and outs of what is a concussion, how to get help, everything that goes into getting care, getting better, explaining concussions a little bit more because some people don't know if they have a concussion, don't know when they could return to play, and what route to take to even get better. So we're going to jump into all of that. If you guys have any questions, leave them in the comments section below, and we'll try to answer them as best we can. All right. So, Dr. Jeff, we are starting off with concussions here. So, symptoms of concussions.
Mm-hmm.
Jeff, what are some neurological symptoms that can happen after a head injury?
Absolutely. So some of the big ones, obviously, headache first and foremost. I think that's the one that most people associate with concussions. And then you can continue to get a little bit deeper. Some people, I know some of my concussions, it was sensitivity to sound, sensitivity to light. Obviously, some people do get dizzy. Some people get nauseous. Some people probably can have some ringing in the ears as well. And one of the best that I ever heard was from a teammate of mine. He described it for those of you who have been through this. They said it almost feels like it is the world's worst possible hangover.
Yeah.
If your body just is not functioning, it feels run down, it feels like crap, and it's so hard for you to just focus, like brain fog, certainly, just kind of to function.
Absolutely. And it's important to note that each individual concussion is different for each person. So a lot of people will have similar symptoms, and then you'll also get symptoms that another person doesn't have. It's very unique to the individual.
Yeah.
I had hand tremors, severe knee pain. A lot of people report high anxiety, heart palpitations, and depression. Something that they didn't have before the injury. So not only do you have these neurological symptoms going on, it definitely can affect your mood. You can have mood swings, inability to feel emotions or be happy from at times. It's a very scary process to go through. First of all, because if you Google how to get rid of post-concussion syndrome, a lot of scary things pop up. I remember I did that when I first got my concussions, and it's like, oh, you're never going to get better. This lasts forever. And that can just put you in a really depressing downward spiral. So whatever you do, I recommend not Googling your symptoms because worst case scenario usually pops up. And this podcast is here to show you that there is help, there are solutions, and you can heal from post-concussion syndrome. Jeff, now, so do symptoms also, do they happen right after the injury, or can there be a little delayed onset? How does that work, you think?
Yeah, there can definitely be a delayed onset. I think it depends on the nature of the concussion, how you were hit. Did you have multiple bounce points. It all depends on the person, kind of, the conditions surrounding when you were hit. So yeah, I definitely think there's you can have that delayed onset, especially I would say too, if it's like a motor vehicle accident where you might have a high level of adrenaline. Adrenaline's going to override everything. If you're in a high, like, kind of fight or flight mode, you're going to be so dialed in that you might not notice the symptoms until hours, maybe a day or two later.
Yeah, great point. I remember Dr. Drew Hall down in Sarasota, Florida. He got into upper cervical because he had a bad concussion.
Mm-hmm.
His symptoms didn't show up until 8 months later. He
Yeah.
was fine for 8 months, and then his whole world started falling apart. And it was really tough for him to connect the dots because it didn't happen right away. He just thought he was dying. His whole health, his immune system, his neurological system just started to shut down, and he didn't know what it was coming from until he went to a naturopathic doctor that asked him if he had any head injuries in the past. So
Yeah.
it's very difficult for people to connect the dots because there can be a very big delayed onset of symptoms. And it doesn't take a huge concussive blow to get post concussion syndrome.
Mm-hmm.
Dr. Jeff and I were talking about this yesterday. It can be cumulative.
Yeah.
So you could have a bunch of minor ones that kind of just build up through your lifetime. And the last concussion you get, even if it's small, is just the straw that broke the camel's back. And that's when a lot of the neurological symptoms come up. For me, I had one really bad one that I was completely fine 2 or 3 weeks later. And then I think 2 years after that, I had a very tiny, somebody elbowed me in the face. I had a helmet on. It wasn't abnormal to the hockey game at all. Some people get those hits 4, 5, 6 times a game. My teammates didn't see me get a concussion. I didn't think anything of it. And then I woke up 2 or 3 days later in a world of pain. So I didn't even know if I had a concussion because I was talking to my teammates. They're like, we didn't even see you get hit.
Yeah.
And I was like, I know, but I feel really concussed right now. So it doesn't have to be a huge blow to the head. It can be a minor one. We're going to go over why that is and the structural components of the neck and the brain. And so that's really what we want to go over today. Most people, when they get a concussion, they go to their primary care physician or they'll go to the emergency room and they'll do MRIs, they'll do CAT scans, which is important. They're checking to see if there's any internal bleeding of the brain, any swelling. That's very important.
Yeah.
Most of the time, those tests are going to come back negative. So even if those tests do come back negative, it doesn't mean you're not concussed or you don't have a concussion. It's a very good sign that there's no internal bleeding or there's nothing very seriously wrong.
Yeah.
But everybody after a concussion, most medical doctors are looking at the brain where the problem may be right below the brain in the upper neck.
Yep.
Now, Jeff, why is that? Why can, after a post-concussion injury, why can the injury actually be in the upper neck and not the brain?
Yeah, and that's a really good point that is not often addressed. And as you and I have talked about, usually I would equate it to kind of like a whiplash injury. You've had other docs here on the podcast who have talked about the weight discrepancy between the head and the neck, and that the head is literally like putting a bowling ball on a stick. And the next, when you have a 13-pound bowling ball stacked on top of a stick, then the stick's going to kind of go with what's going on with the head. So, for example, to bring it real time, when I had my concussion, my first concussion, I definitely know that I was going into a tackle. I went to make the tackle. I bounced off the guy. So that's probably one where my body changed direction rather quickly. That's going to put some tension on the neck.
One impact.
And I went and hit the ground. So now the initial injury is going to cause the neck to kind of bell up. The head's going to start to whip back. I hit the ground from what I can piece together. And then, so now you have one not going one way, another not going the other way, and then you're going to bounce up and hit your head forward. So your neck in that whole process is moving back and forth, just trying to hang on. And oftentimes people go right to the brain, rightfully so. A concussion is a form of a traumatic brain injury. So you want to make sure there's no, bleeding, swelling, anything going around the brain. But that's not the end of the process. You have to go then and check the neck, because the neck is probably something that got, really, really damaged or really, really aggravated in that process. And when I was looking at stats for this episode, came across one of our fellow upper cervical modalities, the NUCA, on the NUCA website, and they paraphrased a study that found it takes about 60 G's of force to concuss an adult human. It takes about 10 G's of force to seriously damage the ligaments in the neck. So when you put that data together, those numbers together, you can clearly see you can't get a concussion without getting some kind of a neck injury. And that's where people stop usually at the head injury, and they don't continue further down and say, well, if now all the stuff that we talked about, if there's misalignments, if there's subluxations, if there's trauma into the neck, if you don't address that, the brain is going to slowly get better, but these symptoms are going to continue to linger, because now there's a ton of interference in the nervous system, just in a different spot.
Yes. And that is pretty much today's message of the podcast. You can't get a concussion without damaging the upper neck. And here's why. As Dr. Jeff was saying, your head is a 10 to 13 pound bowling ball, and it is supported by the atlas and the axis, which weigh a couple ounces. And there are no disc spaces up here. So it's a very vulnerable area, and it has the most neurological significance right here. Every nerve in your body passes through this gateway here. So when you have some type of head injury, car accident, sports injury, slip and fall down the stairs, and you bang your head one way, not only are you banging your head, you're dislodging your upper neck out of place, and you're causing some ligament damage up there, because it's a very unstable area. So when you do have an impact like that, most of the time, the brain, yes, it can swell, it can get some damage. And then once that heals, you are still out of alignment up here, which is why the post-concussion symptoms can linger on for days, weeks, months, even years. Mm-hmm. So when everybody clears your brain that it's okay, all the tests, MRIs, CAT scans are coming back perfect, nobody is taking a look at the upper neck to see if that's okay. And when this misaligns, we're talking millimeters. Yeah. 1 millimeter can cause a huge neurological insult in the upper neck and the nervous system, and it can cause brain fog, blurred vision, dizziness, headaches, anxiety, depression, heart palpitations, numbness and tingling, a plethora of neurological symptoms that are just not being addressed through the standard Western medical route. Yep. And that's where upper cervical chiropractic comes into play. So, Jeff, how do we fix this condition in upper cervical care? Let's start with that.
Absolutely. As with anything, it comes down to the analysis. You have to have an idea where the dysfunction's occurring, where the interference is occurring. And then you have to be able to assess and see, what's going on. So obviously, in the Blair methodology, we do that in a couple of steps. Obviously, the first one is figuring out where the interference is coming from. What levels in the neck is the bulk of the interference coming from? Obviously, oftentimes it's usually C1, and then right after that, it's C2. And as you were saying, just because that's right where the spinal cord drops out of the skull and into the upper neck, we know that if you break those two bones, that's it. Like this, nothing else functions below that. And so obviously we're not talking as something as severe as, full body paralysis, but it just goes to show how sensitive that area is, that when you have millimeter size misalignments, it's going to impact the nervous system. So identify first and foremost where the interference is coming from. Then, in our analysis, we use the X-rays. We have the 3D cone beam at our office. It's
Gold standard.
Allowing everything you to see exactly how everything is lined up, you can then go through and put all that data together and say, okay, we know that at this level, the segment is doing this on one side, this on another side. We know there's the bulk of the interferences in this area. Now we have an idea of what needs to get fixed, in what direction, and how we need to position ourselves to, in a very optimal manner, move the joint back down its articulation to its ideal spot. And that's going to facilitate healing and remove that pressure on the nervous system.
And I want to talk about those 3D x-rays real quick because those are so important. Dr. Jeff and I both have practiced on plain film x-rays where you could actually put it up to the light, gives you good information. Then it was digital x-rays, which we both practiced with. And that was a little bit better because you can digitally draw, measure things, but it's still a flat image. Now, when the 3D x-rays came into play about 5 or 10 years ago, especially in the upper cervical world, it changed the game. It's actually like you can take somebody's neck, put it in your hands, twist it, turn it, do whatever you want with it. It's very easy to see the misalignment in a 3D image as opposed to a flat x-ray. You will still get great information from a flat x-ray. But what we have found is there was a couple patients that weren't clearing out or doing as well as I would have liked when I just had flat x-rays on them. We put them in the 3D scanner and it completely changed the way we adjusted them. We were able to clear out more nerve interference, get everything flowing, and then they started getting better. So if you are under upper cervical care and you are not getting the results you are desiring, there's a couple different reasons for that. Skill level of the practitioner. Most often, I believe it's the imaging you're getting. If you can't see it, you can't fix it. So if you're under upper cervical care and you're not getting the results you want, I highly recommend getting a 3D CBCT cone beam x-ray. Not every upper cervical office has one, but you can go to an imaging center. You can go to possibly a dental or orthodontal practice. And if you can give that to your upper cervical chiropractor, he or she is going to have a way better analysis to help you clear out the interference, get you holding longer. That could be a game changer in your care. Dr. Jeff and I have both seen it. It's becoming more popular. A lot of more upper cervical doctors are gravitating towards the 3D x-rays. It's still not used in every practice, but if you can get a 3D x-ray on yourself and present it to your upper cervical doctor, I believe, and you're not getting the results you want, I believe your care is going to skyrocket because that's the gold standard, especially if you have a lot of upper cervical neurological issues.
Yeah, 100%.
Yeah. And so we take the x-rays and then what happens? So like Dr. Jeff says, we have to navigate and see which segment's out of place. It could be 1, it could be 1 and 2, could be 1 and 3. Dr. Jeff and I have seen misalignments from C1 all the way down to C5. Every case is different. Every misalignment is unique to that person. So you can't just give the same adjustment to every single person. It is completely customized to the patient to help them get as better as possible. And what we like about upper cervical chiropractic, especially in the concussions, is we say holding is healing. Anybody that's been through concussions knows it's, people base their lives around doctor's appointments. You're seeing the neurologist on Monday. You're seeing your primary care physician on Wednesday. You're going for physical therapy, vestibular therapy. You have 3, 4, even 5 doctor's appointments a week. And that is just stressful in itself. So upper cervical care, we say holding is healing. So our goal is to give you one neck adjustment and have it hold in place weeks to months to years. So your body starts to heal without a practitioner constantly intervening. It puts the power back in your hands to heal. And every couple of weeks, it starts to get better and better until the post concussion symptoms alleviate and are gone and you get your life back.
And you've had a couple of other docs in this podcast who have talked about this as well. But a big thing is with what we're doing is we're not just looking at symptoms. Like, yes, the symptoms are important. We want to, obviously it helps us see how someone is responding because that's what you're measuring. That's what they're coming in with, and that's what you're measuring, how symptoms are improving. But it's going a level deeper than that, and it's saying, okay, I'm not just going to worry about the headache. I'm not just going to worry about the brain fog, the blurred vision, the light sensitivity. where is this coming from? Where is this? What is a potential root cause area that is allowing for the presence and persistence of these symptoms? And that's where looking at this upper neck area, looking at what the alignments of these joints are, and what structurally and neurologically is going on, fixing that, and then giving the body a chance to heal. It's gonna give a lot more optimal chance to heal, as opposed to, the other side of that is, if you go, you can have a concussion. You can and probably will get better. Like you were saying, Kev, your first concussion, maybe 2 weeks, and you were out of the woods and you were good. But the flip side to that is, now you've had a concussion, now you've had some trauma into the neck. Now you have decreased, probably significantly decreased, your body's capacity to handle any future head knocks, any future neck injury, any kind of trauma. Therefore, and this is said outside of our field in chiropractic, is every concussion you have makes you more susceptible to having another concussion. The symptoms usually come back quicker and probably stronger. And I would wager a reason for that is, if you're not looking at these other structural components and these underlying root cause that are decreasing your body's capacity to handle the trauma. Now you've opened the door for these things to potentially get worse over time if you have more of them.
Absolutely. And another thing I wanted to touch on today was, this isn't important for everybody, but it's really important to athletes that are still in their sport and they want to know, when can they return to play. It's definitely possible to return to play after post concussion syndrome. We've had a lot of college athletes return to play, high school athletes, and unfortunately, there isn't one textbook answer that you can just give to somebody. That's what's tricky about concussions. It's it's not like it's like breaking your arm. Rest for 6 weeks, put the cast on, we'll take it off, we'll do a little rehab, and then you'll be back to play. Concussions, every case is different, and unfortunately, the timeline it's not concrete. It's going to be a little bit different for everybody. So return to play guidelines, Jeff. What are your thoughts on that?
I would say, first and foremost, it goes based off of symptoms. I know there's the textbook guidelines. I think usually it's about, like the NFL has their concussion protocol, so they're continuously monitoring, but a lot of it goes based off of symptoms. I can tell you, for my first concussion, when I had it, I was 5 weeks before I was returned to play. Now, granted, I was in chiropractic school at the time, so I'm was more attuned than maybe someone who just gets it in day-to-day life about, okay, I'm still having symptoms, I got to be careful. But I would say it always err on the side of caution. If you're still not feeling 100%, like, I would wager you should probably wait till you're at least 100% to get back out there, because you and I were talking about this yesterday. When you don't, what it leads to, especially with these studies now coming out about CTE, and that's the thing. It's not just the one. It's, are you giving your body a chance to heal? Because if you go out and you have another minor head knock, another concussion, another injury, you've never given your body a full chance to heal. So I would definitely say, you got to go based on how the person is feeling. You got to go on their management. How are they responding? And then I think you titrate up. You have them do depending on the sport, have them do a non-contact practice. Have them do basic drills. If it's football, can they run? Can they throw? If it's ice hockey, can they skate up and down without getting dizzy? Can they do baseline passing, shooting drills without, and feel like they're normal? For soccer, for rugby, it's, can you make, baseline passes? Can you do basic drills? And same thing with basketball, field hockey, lacrosse, all these sports. Can you do the basic drills, the fundamental drills, and be okay? If that's the case, then you just start titrating up from there. And that's why I think the nice thing is about the fact that this is getting talked about more and more and more. Not only are people more likely to go get care after an injury, but now you just have more people who are aware of how to return somebody.
Absolutely. And from an upper cervical standpoint, Dr. Jeff and I have been finding that it usually takes about 3 or 4 months to stabilize the neck. So,
Yeah.
symptomatically, even if you are feeling very good and you're going back to a contact sport such as football or ice hockey or rugby, chances are you're going to knock yourself back out of alignment, because it's a contact sport and it involves the head. And if you do get put out of alignment, we can always put it back in. But
Mhm.
the more uninterrupted healing of this staying in place, the faster you're going to heal. So if you are playing a contact sport like that and you are under upper cervical care and you're wondering when you can return to play, I would give it 4 months of uninterrupted healing where the ligaments and muscles can really mold around the adjustment
Mhm.
and stabilize, because we don't want this to be an ongoing issue every couple months, every year. We want to fix the problem. And if you have uninterrupted healing for about 4 months, it's going to vary a little bit depending on the person's age, ligament stability, and other traumas. But if you can give it that 4 months where there is just a lot of healing taking place, and like Dr. Jeff said, don't just jump right back into the contact, start non-contact practices. Maybe even if it's hockey or something, get on the ice by yourself with 1 or 2 people
Yeah.
and slowly get back. A lot of people ask us when they can lift weights again under care, and we usually recommend, we know even if the person's a weightlifter, we know the person can lift a lot, but we want you to start from where you're engaging your muscles again. So we
Yeah.
usually say start with resistance bands, build that up, and then move to light dumbbells, and then you can start to gradually work your way back up to where you are. It's the same type of thing returning to play with sports. Take it easy. Maybe go 15-20%, maybe even a little less your first time out there, and then gradually pick it up until where you're 100% symptom free, your neck's feeling stable, and your confidence is key too after a concussion. You
Yeah.
can actually probably get a little bit more injured when you're not feeling 100% confident in your sport. If you're shying away from things, if you're not feeling 100%, you're going to be
Mhm.
more in a protective mode, and you might do some things that are going to put you in a little bit more jeopardy. So feeling 100% out there, gaining that confidence, that's huge. Please do not rush the return to play.
And the big thing too is just add on to that is just because you, especially if you're playing a sport or an activity where you have head protection, football, ice hockey, lacrosse, just because you're playing a sport where you might have protection, head protection, doesn't mean that you are not at a significant risk of getting, accumulating more trauma, especially if you return early. Like the equipment's there to provide protection, but there comes a point in time where force going into your head and neck is still force going into your head and your neck, and there's only those things are only so good. And on top of that, it gets back to what we were talking about is you know okay, you have a helmet around your head, but your neck is still gonna whip, and that's still gonna foster these issues that we're talking about. So it's being careful about that. Just because you have pads and protection on doesn't make you invincible. You have to be, that's there to protect you, but you still got to be careful.
Absolutely. And one of the main things I want to jump into right now is what to do if you have post concussion syndrome. Because if I saw a video like this, it would have saved me 5 years of my life. So you have post concussion syndrome, you're dealing with a lot of neurological symptoms. What do you do? Um, Listen, go to your primary care physician, get checked out, get the tests, the MRI, CAT scans done if you can. If it's a part of your insurance plan, you can afford it. That's great. It's going to rule out any serious swelling of the brain and pathological things. It's going to rule all that out, which is great. In my own experience, I don't think there's any medication out there that's going to get to the root cause and help you heal. It's going to mask your symptoms. And with those medications, there's also a lot of side effects that might add on to all the other neurological things you have going on. So, if there is a doctor that's throwing a lot of medications at you, ask yourself, is this going to solve the root cause of my problem, or is this only going to mask the symptoms? So what we recommend if you have post concussion syndrome is, instead of going to the upper cervical chiropractor, which we see is people's last resort, why not make that one of your first options? So maybe go to your primary care, maybe go see a neurologist, see what they have to say. If everything is looking good with the brain, your next step, or I would say even your first step, because we said before, you can't have a concussion without damaging the upper neck, get your upper neck checked by an upper cervical specialist. Now, what Dr. Jeff and I recommend, we practice the Blair technique. So we recommend, if you're trying to find a Blair chiropractor near you, go to blairchiropractic.com, locate a doctor near you. Now, unfortunately, there aren't too many Blair chiropractors out there. So there's about 6 or 7 upper cervical techniques that can help you out. Blair, NUCA, knee chest, orthospinology,
There's
Atlas
Epic,
orthogonal.
Coil, Atlas orthogonal.
Epic. There's about 7 or 8. They're all great. If you have an upper neck injury, they can all take care of it. There's a website called uppercervicalcare.com. It has a comprehensive directory of every single upper cervical doctor in the world. Locate a doctor near you. Find out if there's a couple different options. Look at the Google reviews. Look at the doctor's website. See which doctor resonates the most with you. If you have any questions about this, please contact Dr. Jeff or myself. We're both on Instagram. Obviously, this is on Facebook and YouTube. Just reach out. We practice the Blair technique at Montclair Upper Cervical in West Orange, New Jersey. It's scary when you're going through this. You're not alone. We're here for you, and we would love to help out. Jeff, you have anything to add to that?
I would just say it gets back to a lot of the baseline stuff that we've talked about just across the board. But it's, if you have had a concussion, give yourself time to heal. You rushing back, and I don't say this lightly, but it's not worth the game or two maybe for a scholarship. It's not even if you're a high level, if you're a high level athlete, it's not the longevity of your career, the long-term health of your brain, of your cognition, of your body is worth so much more than trying to return too early, despite what coaches, trainers, agents, whatever it might be, whatever they tell you, it's you got to have time to heal. And if you don't believe that, look at all the concussion stuff that's going on with the NFL players. I mean, that's what happens when you don't let this stuff heal. It builds and builds and builds. And, those families, I would wager, would want their family members here instead of having to deal with all this. And I don't mean to be sad about that, but that is a very serious thing to take into account. So give yourself time to heal. If you miss half a season, if you'll be better off coming back, and you'll be that much more efficient next time. That, just take care of yourself. Give yourself a chance to heal, because that's important.
Absolutely. And that's a great point, Jeff. And take it from me, if your brain is not working correctly, your whole life is going to be miserable. You're not going to be able to function as a person. You're not going to even be able to act like yourself, think. You're going to have too many neurological symptoms going on where it's going to be impossible to function. I've been there. I wish I knew about this before, when I was going through all this, because I thought my life was over. I was told my life was over by a couple neurologists, because they just didn't know how to treat this. So take care of your brain. It's not worth injuring yourself for life. And listen, if you get under upper cervical care, it's possible to, over time return to play. So there are options out there for you. There is hope. We're here for you. And if you have any questions, please reach out.
Absolutely. Yep. It's you can heal 100%. Just give yourself a chance to do that. And, then you can get back at it. And that's what we want.
All right, everybody. Thank you for listening. This will be on iTunes and Spotify and other podcast playing platforms next week, if you want to listen to the audio version. And if you want us to cover any other topics, trigeminal neuralgia, migraines, numbness and tingling,
We got a few in the pipeline that are.
we got some more episodes coming, so we're gonna try to make more episodes on conditions and upper cervical care to help as many people out as we can. So everybody have a great day. Thank you for tuning in, and we will see you soon.